Very good evening to all of you. Myself, Dr. Prateek Gar. So now we will discuss about muscles and nerve supply of the larynx. Very important for the examination point of view. So firstly, there is extrinsic group of the laryngeal muscle. So all the muscles which are outside the laryngeal framework constitute the extrinsic laryngeal muscles. And out of these, first group is elevator, then comes a depressor. By the name itself suggests what are the depressor muscle of the larynx. Why? Again, it is important for the examination point of view. So the depressor muscle are the muscles connecting the larynx to structure below the larynx, like the sternum. So sternothyroid and sternohyoid. Okay. So look at this diagram. The muscle connecting this is my hyoid and this is my laryngeal framework. Okay, so the muscles which are connecting sternothyroid like this and sternohyoid, as you can see, and the omohyoid, sternohyoid and sternothyroid muscle, as you can see in this diagram. So these three group of muscles which are connecting the larynx to the downward structure are the depressor of the larynx. And what are the elevators? All other muscle like the stylopharyngeus, salpingopharyngeus or palatopharyngeus. Salpingo means the muscle connecting to the eustachian tube opening. Stylo is the styloid process. So muscle connecting the styloid process and the pharynx. See, this is above the larynx. So whenever this muscle contracts, larynx will go up. Salpingopharyngeus, again the eustachian tube and pharynx, which are above the level of the larynx. So if they contract, larynx will go up. What are the other muscles? Like the thyrohyoid. Again, this is above thyroid. This is my hyoid bone and this is my hyoid and thyroid. So if this muscle will contract, larynx will go up. So by that you can easily recall that what are the elevator and what are the depressor muscles. Now let's talk about intrinsic muscles of the larynx. So what are the intrinsic muscles? The muscles which are inside the framework of the larynx. So it is again very important because multiple times the question has been asked about the intrinsic muscle of the larynx. So first muscle is aryepiglottis muscle as shown in the diagram. So aryepiglottis muscle, by the name, it is the muscle which is connecting the epiglottis and the arytenoids. So whenever this muscle contract, what happens? This epiglottis will fall over the arytenoids. So what does it will do? It will closes the laryngeal inlet. So try to recall epiglottis and arytenoid connecting muscle, that is the aryepiglottis muscle. If this muscle will contract, so epiglottis will fall down over the laryngeal inlet. So this muscle is responsible for closing the laryngeal inlet. Then the next muscle is thyroepiglottis muscle. This is thyroepiglottis muscle. This is my thyroepiglottis muscle. So what does this muscle do? Suppose this is my epiglottis and this is the part of the this is my epiglottis and this is part of thyroid lamella. So and downwards is the arytenoids. So this joining muscle between the thyroid lamella and the epiglottis, whenever this contracts, epiglottis will turn towards the thyroid. So it will open up the laryngeal inlet. Very clear. I don't think there should be any confusion. So any epiglottis closes the inlet, thyroepiglottis muscle open up the inlet. So then other group of muscle are there like the posterior cricoarytenoid. By the name itself suggests it is a muscle between the cricoid cartilage and the arytenoid which is attaching posteriorly. So you can see in this diagram. So this posterior cricoarytenoid is the only muscle which is responsible for abduction of vocal cords. As you can see, this is a picture or image of the vocal cords. So what happens? Suppose this muscle is going from behind like this. So if this muscle which is going from behind like this, if this contract, so what will it do? It will open up the vocal cords because from posterior it is going to the arytenoid vocal process. So if this contract, this arytenoid will just rotate apart. Okay. So posterior cricoarytenoid is the only muscle which is responsible for abduction of the vocal cords. Let's try to understand another pictures. So look at this diagram. This is my posterior cricoarytenoid muscle shown by the green color. So when this contract, laryngeal inlet will get open because green color is this contrast. Just try to imagine. So the vocal process will go apart. And this all other muscles, all the muscles like the oblique arytenoid, transverse arytenoid muscle, then come lateral cricoarytenoid muscle. These all are responsible for abduction of vocal cords. So only muscle which is responsible for abduction is posterior cricoarytenoid, and rest all muscle are for adduction. That is, adduction means by bringing the vocal cords should be getting together, or they are making the vocal cords closer to each other. Okay. So this is a diagram showing how these muscles are attached. The oblique arytenoid muscle is showing an oblique course attaching to the arytenoids. Posterior cricoarytenoid we have already discussed. Then comes the thyroarytenoid muscles. This thyroarytenoid means the muscle attaching the thyroid and the vocal process. So this muscle is mainly the component of the true vocal cords. We have discussed in the anatomy of the larynx that this true vocal cords, these are the ligament. If we talk about the ligament forming this true vocal cord is the cricovocal ligament in the anterior two-third part, and the posterior one-third part is the vocal process of the arytenoid. And what is the muscle in the vocal cord? That is a thyroarytenoid muscle. It is a part of the true vocal cord. Okay. Now, what are the tensor of the vocal cords? So mainly the tensor is cricothyroid. You can see in this diagram, this is my cricothyroid muscle which is attaching from the cricoid cartilage to the thyroid cartilage. So whenever this cricothyroid muscle contracts, what happens? See, my larynx go little bit, slide like this. So what happens? Look at this diagram. This vocal process or this vocal cords, these are tensed because suppose these are resting in this position, and whenever this cricothyroid muscle contracts, what happens? It will go like this. So little bit length of the vocal cord increases. So this is how the cricothyroid muscle is responsible for increasing the tension of the vocal cords. And this is again the only intrinsic muscle which is lying outside the larynx. So you can see this is somewhere outside the larynx, but it is considered intrinsic muscle of the larynx, and it is supplied by which now? It is supplied by superior laryngeal nerve. We will discuss this. I'll tell you. So now the vocal cords tension will be increased by the cricothyroid and vocalis muscle, which is the internal part of the vocal cords, or vocalis muscle is also known as thyroarytenoid. So this is my vocalis muscle. This is all my vocalis muscle. So this vocalis muscle also known as thyroarytenoid. Whenever it contracts, what happens? The length of vocal cord will decrease. So this is a relaxer of the vocal cords, or we can say decreases the tension. So don't mug up, try to understand the concept, how these muscles are attached. That's how their function is decided. So vocalis muscle decreases the tension, whereas the cricothyroid muscle, it will increases the tension. Now, what is the nerve supply of the larynx? We all know it is supplied by the branches of the vagus nerve. The first coming from upside is the superior laryngeal nerve, which is again divided into two branches. The first one is internal laryngeal nerve, and the second one is external laryngeal nerve. Okay, so this internal laryngeal nerve is a sensory supply to the supraglottis, as this nerve is piercing this thyrohyoid ligament between the thyroid cartilage and the hyoid bone. So this thyrohyoid ligament will be pierced by the internal laryngeal nerve, and it is sensory supply to the supraglottis. If we talk about the glottis or subglottis or infraglottis, so this recurrent laryngeal nerve is the main supply to the rest of the larynx. Okay, so above the level of the vocal cord, sensory supply is internal laryngeal nerve, which is a branch of superior laryngeal nerve, whereas below the level of the vocal cords, the sensory supply is recurrent laryngeal nerve, which is a direct branch of the vagus nerve. You can see in this diagram the recurrent laryngeal nerve. Now, what is the motor supply? So all the intrinsic muscle except cricothyroid. We have discussed in the last slide, cricothyroid muscle is the only intrinsic muscle which is lying outside the laryngeal framework. So all intrinsic muscle except cricothyroid are supplied by the recurrent laryngeal nerve. And this cricothyroid muscle, it is supplied by this extrinsic laryngeal nerve. Okay, so whenever there is any pathology, any trauma to the recurrent laryngeal nerve, what will happen? So all the muscles function will be lost except the cricothyroid. So suppose the posterior cricoarytenoid is also not working. So what will happen? No abduction will be there. But if the recurrent laryngeal nerve is injured, so only muscle which is working will be cricothyroid, and this cricothyroid, along with increasing the tension, this is also an abduction adductor of the vocal cord. So whenever there is a palsy of the recurrent laryngeal nerve, because of retained function of the cricothyroid, the vocal cords will go in adduction position. They will come closer. So what will happen? The airway will be blocked because vocal cord are coming in closer. So that's how any injury to RLN nerve is very dangerous.